Bismillahirrahmanirrahim. Welcome to my channel Science of Life with Dr. Muhammad Yusuf. Today I'm going to start or discuss circulatory shock, and probably I will need two lectures for this. So first part is circulatory shock, but before that, one ayah from Holy Quran. That is, I have selected an ayah from Surah An-Nur, ayah number 19. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Innal ladina yuhibbuna an tashi'a al-fahishatu fil ladina amanu lahum adabun alimun fid dunya wal akhirah wallahu ya'lamu wa antum la ta'lamun. innal ladina, बेशक वो लोग युहिब्बूना जो पसंद करते हैं, अन तशीअल फाहिशतो के बेहयाई फैल जाए, फिल लदीना आमनु ईमान वाले लोगों में, यानी वो लोग जो मोमिनों में मुसलमानों में बेहयाई फैलाने पे को पसंद करते हैं, या उस लहुम अज़ाबुन अलीम, उनके लिए दर्दनाक अजाब है, फिर दुनिया में भी वल आखिरा, और आखिरत में भी। वल्लाहु यालमु व अंतुम ला तालमून, अल्लाह खूब जानता है और तुम कुछ भी नहीं जानते। अल्लाह सब कुछ जानता है, तुम कुछ भी नहीं जानते। कि जिन लोगों को ये ख्वाहिश हो, ये इस बात पे खुश होते हो, युहिब्बूना पसंद करते हो कि मुसलमानों में बेहयाई फैल जाए, आम हो जाए, तो उनके लिए दुनिया और आखिरत दोनों के अजाब की अल्लाह पाक वईद दे रहे हैं, डरा रहे हैं। तो बेहयाई फैलाने के कितने ज़राए हैं, आप देख सकते हैं। माशरे में बेहयाई फैलाने में कौन कौन लोग किस किस तरह इन्वॉल्व हैं। तो अल्लाह पाक हमें इस वही से बचाए कि मैं इसमें न इस्तेमाल हूँ। आप देख सकते हैं हमारे चैनल्स, हमारा माशरा, हमारे मुख्तलिफ फ़नकाराना सलाहियतें लोगों में, पता नहीं क्या क्या बेहयाई फैलाने के तरीके हैं। लेकिन हर इंडिविजुअल, अगर मुझे कोई गलत मैसेज, बुरा गंदा मैसेज आता है, उसको फॉरवर्ड करूँगा तो मैं भी इसका शिकार होऊंगा कि मैं भी बेहयाई फैलाने वालों में शामिल हो जाऊँगा। अल्लाह पाक इस बात की समझ दे कि, और फिर ये अजाब उनके लिए अजाब है जो हमें समझ नहीं आते। अल्लाह बता रहा है कि उनको दुनिया में भी अजाब है। दुनिया में तो हम नहीं देखते, लोग फ्लरिश कर रहे होते हैं बेहयाई फैलाने वाले, लेकिन अल्लाह कह रहा है कि फिर दुनिया में भी अजाब है और आखिरत में तो अजाब है ही। वो उसकी जवाब दे रहे हैं कि अल्लाह जानता है कि उनको अजाब दुनिया में कैसे होगा और कैसे हो रहा होगा। वी डोंट नो, अल्लाह जानता है और तुम कुछ भी नहीं जानते। अल्लाह पाक समझ अमल की तौफीक दे। So we are going to talk about the circulatory shock. What is circulatory shock? It is the depression of the body functions due to reduced blood flow to the tissues, usually because of some cardiovascular disorder or something wrong with the cardiovascular system. It is generalized inadequate blood flow to all the parts of the body, causing deterioration of the functions, depression of the body functions. Whole of the body is involved in this. That is, if blood flow to my hand is reduced, there may be damage to the heart, but this is not shock. This is the local death. Local ischemia may damage some of the tissues. But if the cardiovascular system itself is such that the whole of the body is not receiving adequate blood flow and there is damage to the most of generalized damage throughout the body, that is shock. Usually in shock there is reduced cardiac output. Yes, there are some shocks in which the cardiac output is raised. I will talk about that. But usually in shock there is usually reduction in the cardiac output and there is reduced fall in the blood pressure. These are two prominent features of the most of the shocks. Reduced cardiac output, if the cardiac output is less than required, so it's heart failure. We discussed in the previous two lectures the heart failure. Reduced cardiac output may cause the reduced blood flow to the tissues, and if the tissues are damaged, then the result will be shock. So reduced cardiac output usually, and blood pressure usually falls. It is reduction in the blood pressure. So this is the brief definition of the shock is generalized inadequate blood flow throughout the body, causing tissue damage. Generalized tissue damage occurs in shock. So as I was saying, usually there is a reduction in the cardiac output, but there are some conditions in which there is high cardiac output, but the person is in shock. High cardiac output shock, excessive metabolism, for example, thyrotoxicosis, very high level of, this is one of the examples, there are many others. Excessive metabolism may cause the generalized vasodilatation and more venous return and more activity of the heart. Cardiac output may be 10 liters in 5 liter ke bajay 10 liters or more than that, but still this is not sufficient for this excessive metabolism. So this may be a result into shock. So the cardiac output may be high, but the metabolism needs more cardiac output. So if that cardiac output is not supplying the required amount of the metabolite, the nutrition and oxygen or all the requirement, then this person will go into shock. So high cardiac output shock. One example is thyrotoxicosis. Then abnormal tissue perfusion pattern. For example, there are some shunts. So blood cardiac output is there, it is sufficient or more than normal, but the blood is being shunted out from the tissues and they will be suffering from this cardiac output, the shock will be there. Or when the cardiac output is normal or more than normal, high cardiac output, but the tissues can't utilize the nutrition and oxygen, so there is generalized tissue deterioration of the functions, so it will be shock. So there are many conditions in which there is quite high cardiac output but the person is still in shock. That is, shock may generalize inadequacy of the generalized tissues, nutrition inadequate, oxygen inadequate supply will be there. So electron transport chain poisoning, carbon monoxide poisoning, or something energy metabolism poisoning, that may cause the reduced utilization of oxygen nutrition in the tissues, though the cardiac output is quite high, but the tissues are suffering from the deficiency of oxygen or nutrition, etc. So the person will be shocked. So there are conditions in which high cardiac output shock is also there. Usually, I will just list some of the manifestation of the shock. Patient ko hota kya hai? There is fall in the blood pressure, as I said. There may be tachycardia. Whenever there is fall in the blood pressure, we have discussed the baroreceptor mechanism that will try to correct the blood pressure by increasing the heart rate and force of the contraction. So there will be tachycardia, increased heart rate will be there. Blood pressure is low, but there is pulse is high. And the vasoconstriction should occur because of the fall in the blood pressure will stimulate the sympathetic system, which will cause the tachycardia, and it will cause the venous constriction to attempt to increase the blood pressure. So there will be, because of the person is in shock, there is usually systolic pressure is low. Usually the systolic pressure is reduced and because of the reduced filling and reduced stroke volume, all this will be reduced in shock. And the decreased diastolic pressure. Blood pressure has fallen, there is reduced systolic pressure as well as the diastolic pressure, and the pulse pressure is also low. All the pressures are low, and there is stagnant hypoxia. The tissues, because of reduced blood flow to most of the tissues of the body, there is hypoxia to all the tissues of the body. And the person is pale, cold, and clammy skin. The pale, because of the proper oxygenation is not taking place, the person is pale. The cold, because the normal blood supply to all the tissue has been reduced. And the clammy skin, because of the sympathetic stimulation. Sympathetic stimulation causes sweating as well as the vasoconstriction also causes the cold skin, and the pale skin and cold skin, and there is the sweating because of the sympathetic stimulation. All this is due to sympathetic stimulation. Pale because of the vasoconstriction, less blood flow on the surface, and the cold because of the less blood flow on the surface, and the clammy skin, that is wet skin, some sweating is there. Shock mein sweating hoti hai because of the sympathetic stimulation. So sweating is there, sweating, and cyanosis because of the proper oxygenation is not taking place, cyanosed tissues, and because of the fall in the blood pressure, urinary output is low, decreased urinary output, and there may be some acidosis. pH of the blood may decrease. acidosis because of the accumulation of carbon dioxide and metabolites, etc. They are not being washed away, so there will be acidosis. And the blood flow to the vital organs may be reduced. That is, brain and heart have got the excellent local control of the blood flow. They may suffer in shock even. If they go into, then the further deterioration of the shock will occur. So blood flow to the vital organ is reduced. Blood flow to the brain will cause the fainting. That is, fainting may occur, or the person may become unconscious, and the death may occur due to the brain ischemia or cardiac arrest. If these tissues, they suffer from the ischemia because of the shock, and the person will go into death may occur, cardiac arrest may occur, or the brain ischemia may cause the death. Now, these are the general, a few manifestation of the shock. Patient को होता क्या है? हम physiology discuss करेंगे. We will discuss the stages of shock. Physiology of the shock is the initial stage, some reduction in the blood pressure may be there, which is quickly can be recovered normally without any intervention, or some medicine may not be required. Initial stage. Then there is when the progressive non-progressive shock is the after the initial stage, some more blood loss or more fall in the blood pressure, maybe compensatory mechanism have to be come into play for the to stop the progress of this shock. So this is non-progressive shock. We are going to explain. That is, if the blood pressure falls, the compensatory mechanism will come into action, and they will compensate for the loss, and the cardiac output and the blood pressure will return to the normal. This will be non-progressive shock. It doesn't progress, it doesn't further deteriorate. So this is the non-progressive shock without any treatment, without any involvement maybe of some doctor or something. Shock itself is treated by the compensatory mechanism, or compensatory mechanism, for example, baroreceptor, chemoreceptor, CNS ischemic response will correct it. It is the non-progressive shock. But if the level of shock, level of fall in the blood pressure, or level of reduction in the blood volume or venous return or cardiac output, if the level is such that the compensatory mechanism cannot correct the blood pressure to the normal level, then this may progress to, it may worsen, it may further deterioration may occur, it will progress unless you stop. You can stop it. This progress may be stopped. You can treat it. You will give drugs, and it may be stopped. But this is, if you don't treat it, you don't give oxygen or nutrition or vasoconstrictors or the treatment, or the blood volume is not replaced, or cardiotonics, etc. are not given, then this will progress to next stage. This is the irreversible stage. This may progress to irreversible stage, where any intervention cannot bring back the blood pressure, cannot correct the all the features of shock. So these are the 4 stages of shock. The initial stage, slight reduction in the blood volume or the blood pressure. Slight reduction in the blood pressure, no severe symptoms, just mild slight fall in the blood pressure. May person feel some dizziness, that's all, the person is corrected. Or the vasovagal syncope is another part, that is, the person faints but is corrected itself. That the blood pressure and the blood flow very quickly is restored by the normal short-term mechanism. Baroreceptor, chemoreceptor will correct it. So it is the initial stage of and this is the postural hypertension. Example is postural hypertension. Some people have got more, you may have experienced sometime, even the young people may experience, but in old people, it is quite common. Postural hypertension, the person sitting or lying, when the lying person or sitting person stands up, there may be some fall in the blood pressure and the person feels some dizziness and the loss, but that is very quickly corrected. That is known as postural hypertension. Fall in the blood pressure with the changing posture. Fall in the blood pressure because of the changing posture. I give you the example. The person lying down, when stands up, there may be some fall in the blood, transient fall in the blood pressure. May थोड़ी देर उसको चक्कर आता है and the person is cured. This is the initial stage of the shock. Or emotional fainting, when a person has got some experience of emotion and the person faints. Bad news, for example, the person faints, that is due to the vasovagal syncope. There is the stimulation of the vagus nerve and the blood heart rate falls, and there is the reduction in the blood pressure and the person faints. But during lying position, the person again recovers itself. So that is emotional fainting. That those are the initial stages of the shock. This doesn't need any treatment. But if the level of shock is more, then several compensatory mechanisms may take some time for the correction, but they will correct it without any treatment, without any involvement of therapy, etc. Compensated blood pressure is maintained by the compensatory mechanism. What are those? I am talking about initial stage में भी यही काम कर रहे हैं. Baroreflex, baroreceptor, whenever there is fall in the blood pressure, baroreceptors are stimulated, and the sympathetic stimulation increase force of the contraction of the heart, increase rate of the contraction of the heart, and vasoconstriction will correct the blood pressure. And if it is required, chemoreceptors will also come into action for the stimulation of the sympathetic system, and they will also cause the increased sympathetic stimulation. And then if it is not corrected, even the CNS ischemia is the final blow for the correct final last ditch stand, what we term it. This may correct it, but initially that they are responsible sympathetic stimulation. All these will lead to the sympathetic stimulation, either baroreceptors or the chemoreceptors or the CNS ischemic response if required. Then all this will lead to the sympathetic stimulation. This ischemia to the brain and heart is prevented by the autoregulatory mechanism. During this, as I said, brain and heart autoregulatory mechanism is very sensitive, and it is very quickly restored. The blood flow regulatory mechanism is excellent in these two vital organs. The decreased blood flow to the non-vital organs occur because of this sympathetic stimulation. This sympathetic stimulation doesn't cause severe vasoconstriction in the brain vessels. It doesn't cause severe vasoconstriction in the heart vessels. But the non-vital organs like skin or the muscles or other tissues, non-vital organs, there is generalized vasoconstriction because of this sympathetic stimulation. So blood is distributed to the vital organ. It is redistributed, it is shunted to the vital organ by the vasoconstriction throughout the body. So when the venoconstriction occurs because of this sympathetic stimulation, causes venoconstriction, it increases the mean circulatory filling pressure, and we have discussed it, and that will increase the venous return, that will try to increase the cardiac output. So all these compensatory mechanisms will come into action, and the blood pressure will be maintained. It will return to the normal without any involvement of the extra therapy or involvement of the physician or doctor. But if these compensatory mechanisms, they fail to maintain normalize the blood pressure, then with the passage of time there will be continued deterioration of the generalized function. That will lead to in the progressive stage, that is compensatory mechanism fail to maintain the blood pressure and the blood flow to all the tissues. So blood flow is still reduced, the tissues functions are still deteriorating, so the shock becomes gradually worse, because the compensatory mechanism have not completely corrected the blood flow to all the tissues. So there will be the reduction is still there, reduced blood flow is there, and the deterioration of the function is gradually increasing, and the shock is worsening. It is still reversing. Reduction in the blood pressure continues, and the pulse pressure further decreased, and the myocardial activity is further reduced, because heart may be involved. Initially, the heart maintains its blood flow, but if further worsening occurs, the heart may cause there may be reduced blood flow to the heart as well. So myocardial activity will be reduced, or the force of the contraction may not be sufficient. Then the reduction in the cardiac activity will be there. Myocardial activity is reduced, and arteriolar tone is reduced. Initially, the sympathetic system causes vasoconstriction, but if it is not to the blood pressure, the cardiac output doesn't return to the normal, and the vasoconstriction is there, and the deterioration of the function throughout the body will cause the production of more metabolites, reduced blood flow to the blood vessels themselves as will occur, and this will cause the vasodilatation instead of vasoconstriction. So there will be arterial tone will be reduced instead of normally sympathetic tone meant, and the sympathetic stimulation causes vasoconstriction, but if the progress is not stopped, then the vasodilatation will occur. So reduce tone, and that will cause the reduced peripheral resistance, that will further cause further decrease in the blood pressure. So the progress, but the progress may be stopped. All this progress can be stopped by intervention. You can treat it. That is, this is treatable. This is curable. That is, you can give blood, you can increase the blood volume, you can give the fluid, you can increase some sympathetic stimulating drugs as well, etc., or the postural therapy maybe. So you can intervene and it can be treated. So progress may be stopped by the treatment. Proper treatment, which is out of our scope, physiological scope, a few things we will talk about at the end. So the progress may be stopped. Progressive shock, you can handle it. You can treat it. Doctor will intervene and the progress may be stopped. So this progress may be stopped. So this is the progressive stage. But if the level of shock is such that even treatment fails, it has gone to irreversibility, then that is known as irreversible shock or irreversible stage. That is last stage before death, of course. When any therapy is not capable of increasing the blood pressure or curing the shock, treating the shock, then the last stage before death, deterioration of the most of the tissues, including CNS, including myocardium, including liver, including kidneys. All the systems are failing, deteriorating, and this will lead to the irreversibility. So brain ischemia will lead to what we term as the loss of consciousness, loss of nervous functions will be there. The person may become unconscious, and the myocardial ischemia may cause the irreversible damage to blood flow to all the tissues has been reduced, including brain and heart. So the brain ischemia will cause this unconsciousness, loss of the nervous function, and cardiac ischemia may cause damage to the myocardium. Irreversible damage may occur, and the myocardial activity is severely reduced. Or the person is in shock, and when the myocardial activity is further reduced, the further worsening of the shock. Arteriolar tone is drastically decreased. पिछली slide में भी हमने देखा था. Sorry. That is, arteriolar tone instead of vasoconstriction, vasodilatation has occurred, so peripheral resistance is further reduced, drastically reduced, and the blood pressure falls drastically, and person may go into, that is, even the infusion of blood fails to restore. Any drug will fail to restore, and no therapy is adequate to maintain the life in the irreversible stage. So these are the stages of the shock. So no therapy is adequate in irreversible stage. कुछ डायग्राम भी हम आगे देखेंगे. So this is general view about the shock, any type of shock. We are going to discuss the types of shock in next lecture. This is general overall discussion about the shock. What can causes of shock? Reduced blood volume, very common cause. That is some accident, some damage to, and there may be excessive bleeding, hemorrhage, hemorrhagic shock. That is known as hemorrhagic shock. That is the hypovolumic shock. Volume is reduced. When the blood volume is reduced, for example, hemorrhage, very common, accident, And the trauma to the tissues, maybe bleeding is not occurring, but there is a generalized trauma to the tissues, and it will cause the extravasation of the blood inside the tissue, and maybe many other causes. So trauma to tissues, muscle damage हो गया, bone टूट गई हैं, the leakage of the blood into the tissue by bleeding चाहे ना हो रही हो. So trauma to the tissue will cause the hypovolemia. Surgery में, of course, the person is surgery में there may be bleeding and there may be loss of the fluid, and the उसमें भी if it is not properly handled, then the hypovolemia may occur, and this will cause the burns. When the burns and dehydration collectively, dehydration due to diarrhea and vomiting or other causes of the dehydration. Sorry. Sorry. So dehydration, loss of water because of the burns, because of the non-availability of water, or because of the excessive diarrhea, excessive vomiting, many conditions of the excessive sweating. So dehydration due to burns or other causes of dehydration, there will be hypovolemia. Blood volume may be reduced. So this reduced blood volume causes of the a few causes of the reduced blood volume. When blood volume is reduced, venous return, mean circulatory filling pressure. Apply that knowledge which we have discussed in the previous lecture. So reduced blood volume will cause the reduced mean circulatory filling pressure, mean reduced venous return, reduced cardiac output, and the blood pressure is going to fall. Or increase. This is a reduced blood volume. There are cases in which the blood volume is okay, but the total vascular capacity increases. The vessel can accommodate 5 liters of blood, it is okay. But the vascular capacity, if it becomes 6 liters, so 6 liters may be required. So increase vascular capacity, for example, neurogenic shock. That is neurogenic shock. There is normal vasomotor tone. There is constant sympathetic tone for the blood vessels. If that sympathetic system is withdrawn, that the person will go into shock. The neurogenic shock, that is inhibition of the sympathetic system. Normally, every person has got the sympathetic tone throughout the sympathetic system is supplying the blood vessels and arterioles and the heart even. And if the sympathetic system is withdrawn, there is generalized vasodilatation and the heart activity will be reduced, and it will lead to the neurogenic shock. So total vascular capacity will increase. Then the anaphylactic shock. You must have studied the allergic condition in which there is excessive, this is also known as histamine shock. There is vasodilator, histamine is produced by the mast cells or basophilic cells. So this histamine will cause generalized vasodilatation. So vascular capacity will be increased, so person will go into shock. And the septic shock, that is if there is septic infection somewhere and that spreads throughout the via blood, and there is generalized vasodilators produced in this septic conditions, and the septic shock will occur. We are going to discuss the septic shock in next lecture, inshallah. So these are the conditions in which there is increased vascular capacity. Now reduce blood volume, all this, and they increase vascular capacity. The result will be all of this. If either the blood volume is reduced or the vascular capacity has reduced, they are going to reduce the mean systemic filling pressure and decrease venous return. If blood volume is less or the vascular capacity is more, that will result into the disproportionate blood volume and vascular capacity. That is, blood volume is less and vascular capacity is more, so it will reduce the mean circulatory filling pressure, and on which the venous return depends. If there is reduction in the mean circulatory filling pressure, there will be a reduction in the venous return, and cardiac output will be reduced, blood pressure will be reduced, the shock will occur. So causes of shock continue. These do reduce blood volume and increase vascular capacity. Now further, obstruction to the blood flow. If the blood flow is obstructed, proper filling of the heart is not taking place because of some obstruction. So that obstruction will lead to the reduced cardiac output and etc., or maybe reduced venous return if a big vein is blocked. So the cardiac tamponade, if there is fluid in the pericardium, and that will cause the restriction of the filling. it will doesn't allow the proper filling of the heart. The person is going to reduce the cardiac output. So cardiac tamponade, tumors in myocardium, something wrong, some tumor blocking the coming of the blood or venous return into the heart, or the thromboembolism and bigger blood vessels may be blocked by this and reduced cardiac output will be there. So the obstruction to the blood flow, heart is not properly filled because of these obstructions to the heart. So, and then the cardiac diseases themselves, myocardial infarction, we discussed in previously before the heart. We discussed the coronary artery disease or the other cardiac diseases, cardiomyopathies, for example. So the cardiac diseases which reduce the pumping effectiveness of the heart, pumping ability of the heart, that is myocardial ischemia. We discussed the CAD, coronary artery diseases, and the congestive heart failure, any cause of the heart failure. This is the cardiac condition. Heart is failing. We discussed the heart failure in the previous two lectures. So any cause of the cardiac failure, the valvular disease or arrhythmia, any cause of the cardiac failure will cause the cardiac abnormality and arrhythmia and the valvular diseases. All this will lead to the decreased cardiac activity. So the obstruction to the flow will reduce the venous return. We have talked about because the less filling of the heart is taking place and the venous return has been reduced, so there will be reduction in the cardiac output as well. Reduction in cardiac output. And all this cardiac diseases will cause the decreased pumping effectiveness of the heart. Pumping ability of the heart will be reduced. So all this will lead to the reduced pumping ability of the heart. All these cardiac condition will reduce the pumping ability of the heart. Venous return reduction also reduces the pumping ability because the Frank-Starling's law is there, property of the cardiac muscle. More the venous return, more will be the pumping ability, more forceful contraction of the heart will occur. So reduced venous return also causes reduced pumping ability. Cardiac condition and this indirectly, this also causes the decreased pumping ability, and when pumping ability is reduced, it will reduce the cardiac output. This will reduce the blood pressure, so person will go into shock. So these are causes of shock. So volume reduction, increased capacity, obstruction to the flow, and the pumping ability of the heart reduced by many diseases, all will lead to these are the causes of shock. Hypovolemia, very common cause of the shock is hypovolumic shock. Reduced blood volume due to hemorrhage, due to dehydration. So the cardiac output is reduced, venous return is reduced, blood pressure falls, and the person manifestation of the shock, which we term that there will be thin thready pulse. That is, volume of the pulse is reduced and the heart rate is more. So thin thready pulse and the pale clammy skin, cold skin, we have talked about. These are the manifestation, and the increased respiratory rate. Because the tissues are not receiving proper oxygen, more carbon dioxide is accumulating. That will increase the respiratory center, and the respiratory rate will increase and attempt to increase the oxygen supply to the tissues suffering from hypoxia. And the person is restless, something brain is not receiving the proper oxygenation or proper nutrition. The person may be restless, inadequate blood flow to the peripheral tissue, and it is generalized inadequate blood flow to the tissue. So the hypovolemia will cause this shock. Now, effect of hemorrhage on cardiac output and blood pressure. This diagram is showing us the effect of percentage total blood removed. If the 10% blood is removed, you can see this blue graph is for the arterial pressure measurement, and this red graph showing the cardiac output. You see 10% blood loss is compensated. Blood pressure is maintained and the cardiac output is maintained, even 10% of the blood loss. Or 15% of the blood loss will be there. Blood pressure is still maintained, but the cardiac output has been reduced, but the blood pressure remains normal. The compensating mechanisms are maintaining the blood pressure. Cardiac output is being reduced because of the removal of the blood, hypovolemia, but the compensatory mechanism, sympathetic stimulation, baroreflex, chemoreflex, or maybe CNS CNS ischemic response, they are maintaining the blood pressure. There is no need of the CNS ischemic response. We have discussed CNS ischemic response comes somewhere when the blood pressure is below 50. Here, CNS ischemic response will come into action. So the 20% blood loss, there is nothing wrong with the blood pressure. Blood pressure is maintained. Though the cardiac output, 20% blood loss, 1 liter of the blood loss, that is 20% means 1 liter of the blood loss is compensated by the compensatory mechanism. Blood pressure is maintained, though the cardiac output has been reduced, blood pressure will be maintained. And if further increase in the blood loss is there, both cardiac output and blood pressure will be reduced. 30% blood loss, it is cardiac output and blood pressure both will be reduced. And when this has reached the 50 level, below 50, CNS ischemic response will come into action, and that is, this plateau is because of the CNS ischemic response. If falling blood pressure, suddenly there is some plateau because of the CNS ischemic response comes into action here, and this is maintained. But if the more blood loss has occurred, 40% has been removed, so it may go into the irreversible stage. So the person may die because of irreversible stage. Here, progressive shock. Now, this is the CNS ischemic response because this maintained arterial pressure for some time is due to the CNS ischemia. And the rest, this is the initial stage, that is the compensated state, and this is the progressive stage, and this is the irreversible stage of the shock. So the effect of hemorrhage percentage of the blood volume loss on the cardiac output and the arterial pressure. Compensatory mechanism, we have discussed it. I will go quickly through this slide. What are the compensatory mechanisms? Those are blood pressure is maintained by baroreflex, chemoreflex. I have just discussed it. So the CNS ischemic response, we have seen in the diagram, sympathetic stimulation. This is the same slide. And all leading to vasoconstriction. Vasoconstriction, because of the sympathetic stimulation, it will increase the peripheral resistance and blood pressure will increase. Venoconstriction, veins are constricted, capacity is reduced, there is the increased mean circulatory filling pressure, causing increased venous return and increased cardiac output, and blood pressure will increase. And then the force and the rate of the contraction, because of sympathetic stimulation, it will increase, it will try to increase pumping ability of the heart. Sympathetic stimulation more effective in blood pressure maintenance. This is all sympathetic stimulation. ये क्यों लिखा है? Sympathetic system is more effective in maintenance of the blood pressure. ये जो अभी हमने देखा, less effective in cardiac output maintenance. ये जो diagram में हमने देखा. The blood pressure is maintained. It is the straight line, though the cardiac output is reduced. Sympathetic system increases the blood pressure, maintains the blood pressure more effectively than the cardiac output. Cardiac output has been reduced, but blood pressure has been maintained. This sentence means sympathetic system is more effective in blood pressure maintenance than the cardiac output maintenance. So in this diagram we have seen importance of sympathetic nervous system. Sympathetic system importance, we have seen it. That is, with intact, if the sympathetic system is intact, even 30 to 40% of the blood loss may be compensated. Diagram में हमने देख लिया, sympathetic system tries to even compensate even 30% blood loss. And without sympathetic system, only 15% blood loss or 20% blood loss may go into irreversibility and shock may occur if there is no sympathetic system. Sympathetic system so important, that is only 10-15% blood loss may cause death if sympathetic system is not there. So sympathetic nervous system is activated within 30 seconds of the hemorrhage. Whenever bleeding occurs, hypovolemia or any condition, blood pressure falls, within seconds, 30 seconds maximum, within seconds sympathetic system is activated and it tries to maintain the blood pressure. Other compensatory mechanism, this is more important compensatory mechanism. ये तो हम देख के आ गए ना. These are these compensatory mechanisms. These are the compensatory mechanisms. There are other compensatory mechanisms. We know it. That is, other compensatory mechanisms are, number one, reverse stress relaxation phenomena. This we have discussed previously. Reverse stress relaxation phenomena to increase the blood pressure. And the capillary fluid shifts from the extravascular spaces into the intravascular space to increase the blood volume. So the renin-angiotensin system also, these are the intermediate mechanism for the maintenance of the blood pressure. So intermediate action mechanism will come into action. Vasopressin is one of the intermediate mechanisms. So renal body fluid system is the last one. That is the long-term control. So other mechanism may be involved with the passage of time. Initially intermediate, those were the rapid mechanism, chemoreflex or the baroreflex and the CNS scheme. These are the intermediate mechanism, and this is the long-term mechanism to maintain the blood pressure. So the more absorption of the fluid from the intestine will also play. That is, more fluid absorption from the intestine will occur. Compensatory mechanism, coronary and the cerebral blood flow is more effectively maintained, as we have अभी पहले भी बात कर चुका हूँ. That is, they have got the less vasoconstriction by the sympathetic nervous system. SNS stands for sympathetic nervous system. Local autoregulatory mechanism in brain and heart is very efficient. Arterial pressure and different degrees of the hemorrhage. This is that we are plotting shock and with passage of time. If the shock occurs here and within 0 minute pe shock occurs, if the shock level is this, it will be maintained normally. And if more bleeding occurs, second curve may be there. So with the passage of time, within 1 hour it will become rare. Within 2 hours it will go, so it is maintained that. But if there is bleeding, is excessive bleeding occurs and the blood pressure has fallen to this level, so this curve is the compensated state, then it will go into the progressive stage. And excessive loss of blood will quickly go into the progressive stage. So the arterial pressure at different degrees of the hemorrhage, that is the non-progressive stage. These three curves, the non-progressive stage, initial stage and the other non-progressive. Compensatory mechanism can correct the fall in the blood pressure. Then the progressive shock, this is progressive shock, it is progressing. If we can stop it, it will return to the normal. That is intervention by the doctor or by the drugs utilized. This will return to the normal, and otherwise it will progress to irreversibility. Critical degree of shock, critical pressure determine the final outcome of the shock. That is, in dogs, blood pressure above 45 millimeter of mercury. Dogs में ये देखा गया, if the blood pressure is above 45 millimeter of mercury, it can be recovered. But the pressure below 45 millimeter of mercury will progress to irreversibility. 45 millimeter of mercury के बाद it very quickly progresses to irreversibility, where you can't handle it. So the shock itself breeds more shock. So that is vicious cycle will occur. This diagram that is in your Guyton. That is not a very complicated diagram. Shock has occurred, decrease cardiac output, decrease arterial pressure, decrease systemic blood flow, causes decreased cardiac nutrition, causes decreased nutrition to all the tissues, intravascular clotting may occur, and it will further decrease the venous return. Tissue ischemia will cause the release of toxin, which will cause the vasodilatation, and the decreased nutrition to the tissues will further increase the capillary permeability, etc. So all these conditions will be causing more shock. This is the explanation of this, that is shock breeds itself more shock. Vicious cycle will start. So this and the important features of this vicious cycles are that is cardiac depression continues. Cardiac depression further brings the shock, and the vasomotor tone failure may occur. It will continue, and shock will be worsened when even CNS ischemic response fails. We had seen in that diagram CNS ischemic response. It doesn't increase the blood pressure, then it will go into irreversibility. So the CNS ischemic response, blockage of the small blood vessel diagram में भी देखा है. Blood flow is sluggish, so there will be some clotting may occur in the blood vessels, and this will further block the blood vessel, further reduction in the venous return, and intravascular clotting due to the sluggish blood flow, and the increased capillary permeability because of the decreased nutrition supply, decreased oxygen supply to all the tissues of the body. There will be accumulation of the metabolites, accumulation of carbon dioxide dioxide, lactic acid, adenosine, many other vasodilators, lactic acid. So this will increase the permeability due to hypoxia and release of toxin by the ischemic tissue. The tissues which are suffering from the decreased nutrition, etc., there will be producing some other toxins which may further deteriorate the cardiac function or the vascular function, etc. And the endotoxin cause further cardiac depression, etc. And generalized cellular deterioration will occur. So it is progressing shock. Increased cardiac depression. This is normal cardiac output curve, and it is decreasing cardiac output. We have seen these curves several times. Decreasing pumping ability is increasing with the passage of time. 2 hour phase cardiac output is here. Cardiac output curve is like this. 4 hour. It is progressing. It is depressing, and the person is going into irreversible stage. So the irreversible shock. This diagram. This is last diagram. This is the hemorrhage. If the bleeding has occurred and the blood pressure, this is the cardiac output has reduced, blood pressure has reduced, and then the compensatory mechanism will try to its progressive stage. This is progressive stage. It may progress, but we can intervene and हम इसको correct कर सकते. If we don't correct it, it will go into the irreversible stage. And in irreversible stage, this is the where we will intervene and blood pressure or cardiac output will increase to normal. But if it has gone into irreversibility, this is the irreversible, sorry, let me see that. Irreversible stage, when it has gone to, this is the irreversible stage, this part. This is the progressive shock and this is the irreversible shock. If you give transfusion, इस stage में if you give blood, 4 pints of blood आप दे दो, the blood cardiac output will raise, but it will not be maintained, it will go again to down. Irreversibility cannot be corrected. For the time being, there may be increased cardiac output, but it will not be maintained that because the tissue have been destroyed, tissue function have been destroyed, cardiac function have been destroyed. So the treatment of shock, which is out of our scope, we don't have to discuss it, but some physiological basis of the treatment we can call. That is you maintain the blood volume. You give the blood volume. Blood transfusion or the plasma transfusion or that is the transduction of the plasma substitutes. अगर plasma या blood plasma available नहीं है, you can give the plasma expanders like dextran solutions or the concentrated human albumin solution or the normal saline. You can give the hypertonic solution may be given in these cases. Hypertonic solution, what is the advantage of normal saline? 0.9% sodium chloride. If the 1% or 2% sodium chloride or the other dextran hypertonic solution may be given. What is the advantage of hypertonic? Hypertonic solution will increase the osmotic pressure of the blood and they will maintain the blood pressure. Hypertonic, the more osmotic pressure will maintain the intravascular level volume. And the sympathetic stimulating drugs, which are known as sympathomimetic I. There should be I here. Sympathomimetic drugs, and the glucocorticoids are also given, and oxygen therapy, and the postural therapy is also there. Foot end has to be raised to maintain the blood flow to the brain, etc., vital organs. So postural changes, that is given. So that is about shock. We are going to talk about more about this shock, especially next lecture. We will talk about next lecture. That is the types of the shock we will discuss next time, inshallah ta'ala. So our next video will be again circulatory shock, second part, and the types of shock. So hope you are following me. Thank you very much. If you have got some problem, you can ask in the comment section. And then last request, that is subscribe my page and share these videos to other medical students. Thank you very much.